Good morning. It's really a pleasure to be here, and especially it's that this last 2 years, the group of Oxford have an amazing participation in the response of Zika outbreak in Brazil. It's supporting different groups, and this talk is much a small way to thanks for all this support. Then I work in Oswaldo Cruz Foundation. Oswaldo Cruz Foundation is it's a part of Ministry of Health in Brazil. It's a very traditional foundation related to research in infectious disease, more than 100 years now. Oswaldo Cruz Foundation has centers in different parts of the country. During the Zika outbreak, Fiocruz had a major role in different aspects. Sorry. Okay. In last 5 or 10 years, we saw different outbreaks emerging in tropical areas, and still now in 2017 we are observing several new threats that can come from this area. Brazil now is faced to a new outbreak, basically yellow fever in some areas very close to the large urban centers in the country. For other side, Zika is going to India, and other still MERS is affecting several areas in Lebanon and Saudi Arabia and Emirates. As a clinical researcher concerned on emerging infectious disease, we really want to move from this kind of clinical research response very late during the outbreaks to something much early. But the experience of the last outbreaks probably were not so favorable to the way that we work in these last years. I mean, especially after Ebola outbreak, different groups start to a kind of reflection around what needs to change. And for example, this paper that includes groups from US and England proposed at point of view of action at least 10 points. So you try during this talk discuss at least these 3 major or key points, that is how to share information during outbreak, how to facilitate and accelerate the funding, and especially how to move this research to something that the population have access to this benefit. And just to point, the Zika outbreak in February 2016, WHO announced a public health emergency that 9 months after was basically stopped, or that in 18 November no longer criteria was met to maintain the public health emergency. Then for 9 months we had this large outbreak, and especially this large movement around Zika. And why WHO decided to announce this global emergency? Very different from Ebola. I think that this these words are pretty interesting at point of view of difference of Ebola, where science knew exactly what the virus were able to do. For Zika, what really the behavior of virus were pretty different. And this has some other interesting aspects. But after 9 months, what was the result of this outbreak? At least 84 countries have evidence of transmission, at least 61 after 2015. 13 countries reported transmission by person to person, and 31 countries have reported microcephaly or other central nervous system malformations. And this outbreak had a really important impact in Brazil, and the first message about outbreak is that never this kind of outbreaks comes alone. Usually they come during some special moment in the country. In the case of Brazil, in this year, we had a large political crisis, including the impeachment of the president, a drastic cut in more than 40% to 50% of the budget for science and technology. And also, we had at the same time Olympic Games in Rio de Janeiro. Then really was a combination very complex. And also this outbreak had a lot of media involved, especially in the months before the Olympic Games. For example, this is basically British and American media, and for example, this kind of news that the virus could become explosive pandemic, the Olympic could spark a disaster, and the Olympics need to be canceled. And of course, that is just one part of this story, but much is really very dramatic and humanitarian problem involved in this outbreak. And different from what were expected, Zika outbreak had some specificities that were very different from Ebola, for example. Zika was really a low case fatality, not major deaths were related to Zika infection, and was an infection that is with vector transmission or even sexual transmission, with a significant impact in pregnancy in newborns that was really not expected as a pandemic or a major outbreak involving these specific populations. And for other side, high potential to become endemics. And for other side, the virus was known after the 40s and the 50s, but this new behavior and especially these new mechanisms of disease were completely new. And some of the points that I will try to share and discuss with you is how to answer these questions or these challenges, that is how we can improve our way to share data during outbreaks, what we learn during the Zika outbreak, and especially how to establish and facilitate the funding for research, and how ensure that the society will be benefited by the research. And just after the Ebola outbreak, some nice guys started to discuss how the journals could work in a different way during this kind of situations. And they first describe at least 3 reasons where not people want to share data during the outbreaks, and basically data sharing maybe have impact in the subsequent publication. For other side, researchers frequently are concerned about the confidentiality and also how this information can in some way be competitive. For other side, For other side, we know this is a really interesting recent publication in The Guardian some weeks ago about how is the business of, how is the scientific business related to publications, where the global revenues is more than almost 20 billion, with really a high margin with almost 40%, much higher than the main industries, for example, Amazon, Google, or wherever. And especially it's a very strange system where government pays scientists, scientists do the job, and finally government buy the journals. And really it's something a little bit bizarre. But, and also, in general, the publishers are not very happy that all this data are shared. But again, this group proposed that a major impact is to, during this kind of outbreaks, that this information, especially the new information about outbreaks, could be shared much early, and especially share this information in some way, not jeopardize the future publication. And this occurred during Zika outbreak, and I think that this was a major advance. And several groups agree, and especially from the funder side, but also from the publisher side, that during a public health emergency, this information needs to be free and need to be shared. And this was signed by, for example, different groups: British Medical Journal, Bill Melinda Gates, JAMA, Lancet, Elsevier, and Fiocruz, for example. And also, WHO proposed to have kind of repository of a Zika open collection, where in 24 hours all this information that were generated could be online even before a peer review. And also this preprint databases had a very interesting impact on that. And for example, this publication, it's a Nature publication published in June, was online after February. And it was very unusual in the way that usually we do and publish science, for example. But for other side, it's really interesting and for the scientific community to have access almost online data and even before to be peer-reviewed. For other initiatives, for example, like this initiative that is an initiative from CDC where some data repository was open, especially in this case of epidemiological data coming from different countries around Americas, for example. And other amazing initiatives were, for example, this initiative from Wisconsin Medicine, where this Zika Open Research Portal, where experiments were published online with all the variables available for different groups around the world. And basically, they are testing Zika infection in macaques. And this information was available in daily basis. Every day, they include the variables and very detailed information around these experiments. And really, this was something, I think, different from before and very special. And also initiatives as the idea of networks, of a network of networks, and especially networks of researchers working together and sharing information, working with WHO, PAHO, for example, and working in developing protocols, and it was really important, it really had a major impact during the outbreak. And also, the Global Health Network, I think that really moved pretty fast, and Zika infection was online in the beginning, the end of December 2015, and also with several tools and resources available for everyone. And also, I think that this initiative is fructifying, and I think the Rede, I think that is other very important and interesting initiative, how to harmonize protocols around Zika, how to share resources, in this case, in the three different consortiums funded by European Union recently. Of course, that we had also several problems, especially about how to share not only data, but share samples, for example. This is always something very complex during outbreaks. And in the case of Brazil, it was especially complex because during the political crisis, the Ministry of Health changed 4 times. And basically, people were not knowing exactly how to answer, what was the legislation, and in this case, especially how to share samples were pretty complex because some months before Zika outbreak started in Brazil, the government approved a new law about how to share biodiversity, and but they create the law but not implemented completely the law, and was a big mess. And especially Zika virus during public health emergency is something biodiversity. I don't know. But after a lot of discussion, I think that finally people were more understood the problem, and the government and especially decide how to do that in a more concrete way. But when you look especially the publications, we can see that the United States, Brazil, United Kingdom had a really large movement around publication in this 1 year, almost 1 year. A lot of information, new information come from these countries, and especially major connection of researchers in these countries were really important. For other side, of course, the majority of these papers were not original articles, but editorial, letters, news, reviews, but okay. And especially the information comes from epidemiology, public health, in some way surveillance, clinical management, and virology. Very few coming from other areas, for example, vaccines, for example. But it's good to work together, but probably we need more than that. We need really to think together, to develop the work together. I think that this is the major message. Of course, that Brazil is really different from other countries. Brazil is a high middle-income country. We have more than 5,000 researchers in biomedical area, with more than 100 groups working with dengue, for example, in the country with different approaches. And major contributions at the end was done by these groups, and some groups like Ernesto Marques in Recife, the groups of Evandro Chagas in Belém, the groups of Bahia, for example, a really important contribution, and especially the groups of Rio and Fiocruz also had major impact in the discoveries associated to Zika outbreak. Then, of course, I think that the Brazilian scientific community give really a good answer to this outbreak, even in the middle of a political and economic crisis. I think to have these groups working was really a major difference. And when we think about collaboration and cooperation, of course, that is a really interesting perspective that David Hammond published during the Zika outbreak in April 2016, that really let's think about partnership and not parachuting. And of course, this is not the kind of science or collaboration that and the majority of countries are interested in. And of course, during the outbreak, we had some experience like that, people coming, oh, I will organize a network. Man, we have several networks. If you want to work with us, it's a pleasure. But of course, it is important to understand that this cultural difference is also how to work together. And this is a very curious observation from Brazilian Emil Cartanuri, Esther, and also US researchers, and especially how to respect difference in communication styles, all the difference of regulatory in regulation in Brazil and US, for example, all the delays that we experiment in Brazil is something sometimes really complicated, but it's how we work at that. But also, it's very, very funny, this part, especially the Brazilians. The Brazilian scientists like to hug, for example. This is something. Okay, and also how to move samples, and this is something that need some time to be approved. But we have the Brazilian legislation, and of course we need to respect. We, our group in particular, developed a local, I'm the chairman of this network that is an ICU network. But of course, Zika was not something related to ICU. Very few cases of Guillain-Barré or encephalitis were associated with Zika. For other side, my group works with dengue for several years, and we develop a kind of network with neuroscientists, immunologists, pharmacologists, virologists, people from molecular biology, and to try to have a kind of translational research network where clinical samples, autopsy specimens could be also worked by molecular biologists, people from genetics, virology, to have this kind of a more rapid response in understanding of what was going on. And this involved 61 researchers and in different institutions, but Fiocruz and IDOR was the main institutions involved in this network, for example. And this was funded by the CNPq, that is the National Agency of Research. Was not so much funding, was something like 600,000 pounds for 2 years, but was really a good start, and also for 10 groups. But also the majority of groups at this moment in Brazil moved all funding to work with Zika, and also several labs that were labs working neuroscience, for example, all the postdocs and PhD students that were working on Zika in some months. And we started pretty early at the outbreak to look these cases, and in the beginning of 2015, we looked at the first 57 patients in Rio, confirmed cases, basically to have some idea what were the main clinical manifestations, and also to define where the clinical cases of Zika. And after we missed some time from this first study to the moment where really we established a good protocol and cohort, because we waited some funding. And at the end, the funding not come, and we decide, okay, let's do without funding, because we need to do. And this was basically the protocol. was we used these protocols in two situations. This was initially we started working in a large emergency department in a big hospital in Rio, trying to identify all the Arbovirus suspicion cases. And also after we moved for 8 primary care clinics in different parts of the city. And we start identifying patients with clinical symptoms, collecting plasma, PBMC, platelets, urine, and also doing follow-up with several samples, and day 3 to day 5, day 7 to day 10, 19 days, also collecting some quality of life and pain scales and other variables. And now we are interviewed 1 year after all these patients. What were particular at that moment is that not only Zika was 3 outbreaks going together. This is the beginning of 2016, for example. This is chikungunya and some dengue at the beginning, chikungunya, Zika. But now this is still this last summer in Brazil, until we collected samples we still collected samples until the end of April, and still some Zika cases circulating, and chikungunya and dengue. And of course, this year was not so intense than last year, but we still have some activity of Zika, and we can expect new outbreaks of Zika, dengue, and chikungunya for the next years in different parts of the country. Of course, this large outbreak in some way is finished, but the impression is that Zika will be endemic in different areas and still will be spread in other areas. And we are still analyzing data and analyzing samples, and there's some kind of things that revealing case definition and diagnostic accuracy, especially the primary care. It's very complicated to differentiate dengue, chikungunya, and Zika is not so easy. And we are interested to understand the chronic forms of chikungunya. This is a major problem, especially in the age population. We have some studies related to immune response, as Zika is very particular and very bizarre as a virus. And also we work with different groups to develop panels for diagnostic validation. We work with companies and also with the universities to do that, and we share our samples because we think that this is a major and important point to be solved, to have good diagnostic tests to be used by the clinicians. And also we developed, this was a recent publication where we analyzed the sequencing, the genome sequencing of Zika virus in collaboration with different groups in the world. This was a publication in Nature some weeks ago. And I think that this was very interesting experience, especially because in this number of Nature, 3 papers were published simultaneously. This paper that comes from different groups, and this is our the Zika virus evolution spread in Americas, but also the zebra experience in the northeast of Brazil, using a very simple test for genotyping the virus, and also the experience of Florida. And the three groups agreed to submit the papers together. We sent a single letter to the editor, and the three papers were published in the same number. And I think that with a different approach in this paper, and this is an interesting also way to collaborate. There's more than 30 authors, different people from my group, for example, postdocs, people working, nurses, and also all the PIs had some identification in the paper. I think that this is a nice way to do. And in this, we developed a really complex approach because the sequencing of the virus are really complex. The virus, all the sequencing were obtained from primary samples from the blood of patients, and the viremia in dengue is pretty low, and especially is very short. And we used a different approach to have a complete sequencing of the virus. We start with 200 samples from different countries, and using a different approach, we finalized with more than 100 complete sequences. That was really amazing at point of view of outcome of result. And this also give a really good idea how the virus spread around America. This is the Brazilian virus in green, and you can see that basically the Brazilian virus is spread almost for the different regions of the Americas, but the US, for example, that is in red, basically had 4 entries of virus coming from Dominican Republic. And also interesting finding is that using the molecular clock, we can estimate the first case in Brazil, probably in the northeast part of the country, from the beginning of 2014 or even at the end of 2013. And after probably around this February 2014, the virus were introduced in the northeast part of Brazil, and after moved to the north. What is the major consideration about this paper? I think that was really a challenge to do the sequencing, and I think that this really was possible only with this international partnership. For other side, the response was pretty fast. In some months, we had this information available and published. For other side, could be faster? Probably yes. And when we consider that the virus was introduced in 2014 or 2013, probably we are not able to anticipate this outbreak, and maybe we have tools now to anticipate this kind of outbreaks. And also in our group, people are working with the imaging of these babies, and this group is working with more than 245 imagings in different moments of the disease. Now we are imaging and doing cognitive evaluation and imaging in these babies with 1 year, and using different approach to do that, from CT, MRI, ultrasound, and with a lot of information. And also our group are working with other approaches related to brain development. This, for example, paper published for not from my group, but a group from our network, using brain organoids infected by Zika. And this kind of research can generate several informations about how the virus affect, for example, the cell cycling, or even the mechanism of viral replication. And now we are using this method, these tools, for example, the brain organoids to test this new therapeutic approach. For example, as sofosbuvir, that is an antivirus approved for hepatitis C, that has an interesting effect on Zika. Then I think that really, from the science side and the science front, I think that was really an incredible response. But what about funding, and how about the support for science? And in these last years, as a response to Ebola, a new mechanism or new groups are created to support research during outbreaks. And for example, Bibliometric is one of them, and the idea is to have a response until 48 hours with the outbreak. And WHO established a blueprint strategy, and CNPq went to develop new vaccines to a safer world. But we can discuss this, but probably this was not worked as expected. And basically, the major funding was at the end, the European Commission that approved 3 consortium, really late, important consortiums, but really late in the course of the outbreak. The consortiums are really starting to work now. And MRC did a really rapid response, really short money, but what was the first one to propose some response during the Zika outbreak, and also the Canadians and US. The question is really, where is this funding is going? Because when we look the priorities is really different than what the priorities we imagine, because for us, the first priority is humanitarian and medical aspects to support patients, families, doctors that are in the field. For other side, to generate good data and improve clinical management, and at the end, develop new technologies and tools. But this is not the logic that we are looking now. For example, there's an online publication on Lancet from major players in this game. For example, the director of Pasteur Institute and other people involved in the response. And then they propose a diagnostic preparedness for infectious disease outbreaks. But for example, all this preparedness is R&D, not involve major clinical research, validation of tests, development of guidelines, then we are really, this much more how one biotech approach the problem than how it to be the way the funders understand the outbreak response. And at the end, we still continue with this kind of approach with a dengue guideline, a chikungunya guideline, a Zika guideline. And in the majority of these countries, we have the simultaneous circulation of this virus, and we don't have still an integrated approach. And for the future, we'll have several questions, and now health security, something on the table. What exactly is health security? It's not very clear. For other side, how to ensure the access of population of benefits of research. This is also, especially this kind of blueprint and new approach to R&D develop, is not very clear that the affected population will have access to these new technologies. And also, what is the future of global health and multilateral initiatives, especially in this very complex geopolitical moment. And in conclusion, recent outbreaks have imposed major challenges for health systems, researchers, and funders. New mechanism of sharing data and advancing publication was implemented. I think that this is a major point of Zika outbreak. We start to learn how to work in a different way, sharing information. However, how to anticipate the next outbreaks and to be prepared, this is still a challenge. Zika was really an example who expected this kind of outbreak with affecting babies and mothers. For other side, international scientific cooperation is an essential part of this process. Thank you very much.